Hello guys, greetings. I'm Dr. Rehan Nassar, specialist clinical pharmacist. Today we'll talk about GLASCO COMA skill, GCS, which is one of the most important skill that is used for the ICU's patients. It has three main parameters, which they are eye opening, verbal response, and finally the motor response. It has definite numbers. For eye response, 4, the score it will be from 4. Verbal response, 5. Motor response, 6. So the total score that we already have is 15, over 50. Eye opening, we'll start by the 4 score. So first we see that 4 is for spontaneous eye opening. 3, we can give it when we call his name by sound, so he or she open her eyes. And 2, for pressure, when we just try to shake him or push him, he will open his eyes, so that's on pressure. And finally, if there is no any eye response or opening, as none, we will give him 1 as a score. Second parameter we already have is verbal response. We give 5 for orientation. If I'm asking him and he answered well, so he's oriented. So I'll give him the full mark of the full score, 5 over 5. If the patient is confused, I will decrease the score by 1 and will give him 4. If he just gives words, he will give him 3 as a score. If he's just mumbling by sounds, so I will give him 2. If there is no response at all by verbal, so we'll give him 1, the least score in verbal response. The last parameter that we already measured for ICU patients is motor response. We'll give him the score 6 if he obey the commands by moving his hands, moving his legs, so he will take the full marks. If he's just localizing, so we'll give him 5 marks or 5 score from 6. If he made just a normal flexion, we'll give him 4 over 6. If there is an abnormal flexion, we'll give him 3 score. If he just make an extension, so we'll give him 2 over 6. If there is no reaction at all on motor response, so we'll give him 1. So as we said before, the total score is 15. We want to measure if it's mild or moderate or severe, so we can find that the patient, if he has 13 range from 15 to 13, it will be in the mild category. If the patient from 12 to 9 will be in moderate category. And finally, if he was from 8 to 3, he will be in severe category. Thank you so much for watching my video. Please don't forget to subscribe, like, and share our video. And thank you so much for your attention.